Hello everyone. Hope you all are having a great day. Today we are going to talk about the topic acute kidney injury, which is a very important topic of nephrology and it comes in paper 2 of medicine. So let's start. Acute kidney injury definition. It is a sudden decline in kidney function leading to increased serum creatinine, second, decreased urine output, third, fluid or electrolyte imbalance. Now the classification. According to the KDIGO criteria, kidney disease improving global outcomes. AKI is diagnosed if any of the following occur. Increase in serum creatinine by greater than 0.3 mg per deciliter within 48 hours. Second, increase in serum creatinine to greater than 1.5 times baseline within 7 days. Third, urine output of less than 0.5 ml per kg per hour for more than 6 hours. Next we learn about the causes of AKI. So first is pre-renal causes. Mechanism is due to decreased perfusion to kidney, decreased renal blood flow, which then leads to decreased GFR. Cause: hypovolemia, heart failure, liver cirrhosis, NSAIDs or ACE inhibitors. Then we learn about the intrinsic cause, which is due to direct kidney injury, kidney tissue damage, which can be ischemic, inflammatory, toxic. The causes are acute tubular necrosis, glomerulonephritis, and interstitial nephritis. Now we move on to the post-renal cause. Post-renal cause is due to urinary obstruction. Urinary outflow blockage leads to increased pressure, which then ultimately leads to kidney damage. So the causes can be kidney stones, prostate hypertrophy, or tumors. Now we move to the clinical features. So the first general symptoms are oliguria, which is urine output less than 400 ml per day, or anuria, which is urine output less than 100 ml per day. Then second is fluid overload, which can be leading to edema, pulmonary congestion, shortness of breath. Third is fatigue, weakness and confusion, which is due to the toxic buildup, uremia. Second, we learn about the specific symptoms based on the cause. So if it is a pre-renal cause, means decreased blood flow to the kidneys. So the symptoms will be thirst, dizziness, hypotension, tachycardia, which are like signs of dehydration or shock. Then we move on to the intrinsic cause, which is kidney tissue damage. So there will be cola-colored urine in glomerulonephritis and flank pain or fever in interstitial nephritis. This is important. Third, we move to the post-renal cause, which is urinary obstruction, which will lead to difficulty in urinating, lower abdominal pain, and flank pain, which is because of benign prostatic hyperplasia or hydronephrosis. Then we move to the electrolyte and metabolic symptoms. There can be hypokalemia, which then leads to muscle weakness and cardiac arrhythmias, or metabolic acidosis, in which there is rapid breathing, Kussmaul's respiration, and uremia, toxin buildup, which leads to nausea, vomiting, pericarditis, and encephalopathy. Diagnosis. Diagnosis is based on renal function tests. So the first important thing is serum creatinine elevated. Second, blood urea nitrogen elevated. Third, urine routine, in which if RBCs are found, the most probable diagnosis can be glomerulonephritis. If WBCs are found, it may be any kind of infection. If muddy brown casts are found, it can be acute tubular necrosis. Fourth, serum electrolytes. There can be hyperkalemia and metabolic acidosis, means low bicarbonate. Fifth, USG. First, we should go with USG-KUB, kidney ureter bladder, for suspected acute kidney injury. In case of unclear cause of AKI, USG abdomen for broader assessment. 6. Fractional excretion of sodium, FeNA. In pre-renal AKI, FeNA is less than 1%, and in intrinsic AKI, FeNA greater than 2%. So what is the logic? In intrinsic AKI, damaged tubules can't reabsorb Na+, therefore high Na+ excretion. Now we go to the management. So first is identify and treat the underlying cause, which may be pre-renal, intrinsic or post-renal. Second, we must monitor the fluid status, electrolytes and urine output. Third, pre-renal AKI. So here fluid resuscitation is important and vasopressor if hypotension persists. Fourth is intrinsic AKI. stop nephrotoxic drugs, NSAIDs, and aminoglycosides. Fifth is post-renal care. We must relieve obstruction. Thank you. Have a nice day. Keep supporting.